Hello everyone, this is Shad Reis from CVI 2025. I'm privileged to be with a friend and my co-fellow back in the day in the same year, Rahul Sharma, who to talk about today about importance of new iteration of TAVR, which is coming along, and also more importantly, leaflet modification for valve. Rahul,
Thanks
thanks
for
for being
having
with
me.
you.
Thank you,
So
Shad.
tell us what's new with the leaflet modification.
Yeah, so I think, in TAVR, we have had new valve platforms that have come to the commercial market. We now have the Navitor valve for high-risk patients, and of course, for many years, we've had the Medtronic and Edwards valves for low, intermediate, and high-risk patients. But I think the cutting-edge areas of TAVR now are really looking at leaflet modification to prevent coronary obstruction. We have the shortcut device, which, thanks to the work of the investigators in the clinical trial, is now commercial. But we also have transcatheter techniques for several years, like Basilica, and more recently, techniques like Unicorn to prevent coronary obstruction. And then, of course, the classic chimney stenting or rescue stenting to prevent or treat coronary obstruction after valve deployment. So I think there's a lot of discussion happening now in the really great aortic tracks that we had here today, this morning at CVI, focusing on the different types of leaflet modification technologies, what the future will look like. Will it be a one strategy treats all, or will different technologies be needed to treat different anatomies? And then also some really exciting discussions in TAVR regarding bicuspid patients and the need for randomized studies comparing TAVR to SAVR in bicuspids. So I think there's been some great presentations on that here at CVI, and I think these are going to be some of the leading edge issues in TAVR for sure in the coming years, in addition to transcatheter valve replacement for AI, which is going to be coming commercial here to the US.
Leaflet modification, are these easier procedures to perform, or somebody has to go proctor, learn the skills, and bring a device and do it?
Yeah, I think if you're looking at techniques using electrosurgery, like Basilica or Unicorn, those techniques really are very teachable. And if you have someone locally within your region or someone nationally who could come and maybe proctor one case, it is very teachable, and you could then translate that into doing other cases autonomously by yourself. But if it's in the case of a shortcut device, which has just recently become commercial, that may be regulated differently in terms of having someone maybe from the original trial that might come out and show you how to use a device, and certainly you could request that perhaps. But for the electrosurgery techniques using Basilica or Unicorn, those are very teachable and translatable.
Yeah. Well, great overview of the leaflet modification and new technology for TAVR. Rahul, thanks for being with us, and thanks for watching this video and others on CVI YouTube channel. This is Shad Reis coming to you from Austin.